Hello and welcome to The Signal, Workplace NL's health and safety podcast. Workplace NL is the Workers' Compensation Board in Newfoundland and Labrador, Canada. The focus is to promote safe and healthy workplaces, provide return-to-work programs, and offer compensation to injured workers and their dependents. This series of podcasts will provide you with the latest information on how workplaces can protect the health and safety of workers. Please enjoy the show.
The healthcare industry includes complex work environments with a wide range of work activities, professions, and workplace hazards in a variety of work settings. These settings include, but are not limited to, hospitals, clinics, clients' homes, and long-term care facilities. Each setting can create challenges for workers. However, with challenges comes opportunities for improving workplace health and safety and patient care. I'm DeeAnne Feltham-Scott, Occupational Health and Safety Educational Consultant in Prevention Services at Workplace NL. Today I'm joined by Gary Pardy, Director of Employee Wellness with NL Health Services. Welcome, Gary. Thank you so much for joining me here today.
Thank you. Thanks for having me.
Let's begin with, can you just give us an overview of the types of occupational health and safety hazards that workers are exposed to in healthcare?
Sure. I mean, when we look at healthcare, it's certainly so broad when it comes to hazards that we see from an internal view. Right. I mean, we always see such a response to musculoskeletal injuries, strains, backs, shoulders, and those repetitive motions when it comes to client care and, assisting people, whether it's, in transitioning or bedside care. It could be from any facet, really. Even those musculoskeletal injuries from a workplace setup for someone in an administrative capacity. Right. Sitting and a strain on their body from sedentary moments. When we look at some of the, slips, trips, and falls, those winter even, all year round hazards, tripping from cords or equipment or maybe supplies that were dropped or just something simple on the floor. There's such a broad range of what we look at in healthcare. Because when we think healthcare, everyone thinks of, what you see as a visitor or a client or a family member or a friend visiting one of our facilities. But sometimes the hazards that you don't see as, I'll say, a visitor, is those internal working pieces. So our environmental services staff, those repetitive motions of, the cleaning, the food service, the sanitizing, all that background work, all our medical supplies repurposing down, that we see in our MDR departments and vastly through our organization. And then when you look at our maintenance staff, no one really sees what they do, but all the trades that we have and working with tools and equipment and our boiler room staff and high pressure steam and just a vast amount of hazards. And when we even go as far as to look at, we have contractors that come in and do work, facilities maintenance, construction, our new builds or renovations. So, when we look at healthcare, it's sometimes not just healthcare. It's sometimes a little bit more. So when we look at hazards, it's such a span that we are exposed to in healthcare. And some of those being a little bit more exclusive. Needle sticks, radiation. Some of those things we don't see as much in other workplaces that we have in the province, but some of them are quite exclusive when we look at those bodily fluid exposures and those sharps issues. And then,
workplace violence as well.
Absolutely, yes. And when we look at that scope now, it's those psychosocial pieces that our staff, whether it's in our facilities, the hazards associated with visiting someone else's home. It's vast. So when we look at that risk of violence, when we're helping care for clients that are unfortunately sometimes in the best days of their lives and sometimes the worst days of their lives. So it becomes, what we're exposed to from that psychological health piece. Right. So the mental pieces of hazards from violence, whether it's physical or mental.
And I would imagine that there are hundreds of facilities and settings that staff are working in across the province that are related to NL Health Services. When, it's much easier to control hazards that would be like in a hospital or in a clinic setting, but when you're going out into, a home setting, it's much more difficult from the perspective of the organization to control those hazards.
Absolutely. When we look at that span of control, we can put as many pieces in play to try and prevent or control those hazards, especially when they're in our own facilities. Mm-hmm. But when we look at the traveling, the visiting of places or facilities or homes that are not ours, right. So picking on that community or public health setting, when our staff are visiting someone in their own home, we don't have any control of those workplace mm-hmm. settings. So we have to try and mitigate those risks as best we can with the tools that we can employ to prevent injuries in your home while we visit to help care for you or your family.
Yeah, and I guess that's where the importance of having staff conduct that, that pre-work risk assessment. It's quite common in the construction industry. You go to the job site, you do your pre-work risk assessment. No different, I guess, than, going into someone's home. Before you go in, you do your little risk assessment that would identify any other hazards or risk that perhaps wouldn't have been included in the large organizational risk assessment.
You're right. I mean, when we look at our hazard assessments within our own facilities, we're well versed in how we provide care in our own facility, how that looks, how we prevent those hazards from being an injury. But when we look at the assessment of visiting someone's home or a settings that's not under our control, being our facility, we have to do those pre-assessments just to determine if there's, like we said earlier, risk for violence. Is there pets? Is it suitable to get there, especially certain times of the year? Is your driveway plowed? Is your staircase safe to travel? Are there other hazards that we need to be aware of in the home? Who is home? So it really does go back to that pre-assessment piece to do that hazard assessment. And while it is very common in construction, we employ that tool in all parts of our organization as well.
So talking about controls, we know that the best way to identify and control hazards is to develop a framework, a model that can be applied across all professions in healthcare facilities. Like we said in the beginning, you are dealing with many different professions. There are many different job tasks. So having, I guess, that standard model, that standard framework that everybody can use, user-friendly, easy to train, easy to educate people on, is important. So, and in that framework, there are strategies. So what are some strategies that are used to effectively create and maintain healthy and safe working environments?
I think going to the root is truly communication. And while it might be easy for an individual to create a policy and write framework on how I'm going to help you be safe at work, you have to be a part of that process. And we have to collaborate to make sure that while someone who may be a little bit more trained in hazard recognition can apply that framework around someone who knows the work. And no one knows the work better than the workers themselves. I can pretend that I know all the hazards that you're going to be exposed to at your work today, but I don't. You do. So being collaborative and using staff's knowledge to build that framework is truly key. Yeah. Because having an informed group, whether it's an OHS committee, whether it's a group of individuals from a task force, or a collaboration with maybe a group of staff members across the province, collaborate on looking at how do we improve on this policy. Yeah. So we put that framework out in the organization or through the industry, and we apply that as a best practice But once again, if we don't include the stakeholders who are involved in that work, we truly can't create a polished control that will fit the needs of the people who are actually doing the work.
Yeah, I mean, it comes down to the joint responsibility in occupational health and safety for employers, supervisors, workers working together, consulting with each other with the goal and the purpose to making that workplace as healthy and safe as possible. And like you just said, it's the worker participation, it's the communication that is key, because you can't develop policies and procedures on a desk. The workers are the experts. They are the ones who know their jobs. They are the ones that everybody should be consulting with to make sure that the best possible control method, I guess, or measure is going to be put in place that works for everybody. What are some current challenges that the healthcare industry faces that might impact occupational health and safety?
There's a number of challenges, I think, that we have, which be no different than most industries. Some certainly at this point in time are very exclusive to healthcare. Mm-hmm. But as we see our populations age, we see our populations and our communities evolve and change, and complexities of healthcare certainly changing around us. I think it's the evolution of healthcare and trying to adapt to where we are in 2024, mm-hmm. and trying to move forward with providing the best care we can for all the people in the province. But at the same breath, making sure the people who are providing that care are able to do that care, whether that's in our facility, whether it's in a public space, or whether it's in, someone's home. Mm-hmm. It's an emerge or your living room. We need to be able to adapt to where the needs are of our clients to be able to provide that. And in doing that, and any part of evolution comes change, mm-hmm. and change management, and trying to identify best practice and how do we evolve our process. And I think going back again is including our people, yeah. and identifying what are they seeing, what do they need, what do we need to provide. So I think from all levels of the organizations and industry is that commitment to adapt to the challenges, yeah. identify what are the new challenges, and how do we control those challenges. And I think when we look at healthcare now, truly is a state of flux in this province, as we've been going through a number of changing from all the independent health authorities to moving and transitioning to NL Health Services.
That's right.
So while we adapt and change, we're still continuing care.
Yeah.
And that'll never change.
Yeah.
But trying to evolve from that. And when we look at the complexities of what we're seeing day to day, it truly is evolving each and every day.
Yeah. So talking about OSH education and training, they are very important to ensure that employees know how to do their jobs in a healthy and safe manner. What types of education and training methods are used at NL Health Services to make sure that everyone is properly trained?
When we look at providing, one of the three pieces that each and every employee in the province is entitled to have, the three rights. Mm-hmm. And the right to know is mm-hmm. a huge part of this. So when we look at the right to know, it's the right to know the hazards, the right to participate, and the right to refuse work. But when we look at the right to know, it's the right to know about the hazards. And a part of that is the education and the training around that. So as we provide that to staff, from frontline to the organizational to groups, whether small or large, we try to be very vast in how we provide that knowledge across the industry. When we look at every corner of our province, healthcare is truly a part of every part of this province. So when it comes to providing that level of training, we have to be quite strategic in how we provide that instruction from an OHS perspective. So we employ everything from contractors with regards to training providers to provide some legislative training. We do in-house training with sessions with our managers, whether be it at the new supervisors training that we've been doing across the province around their responsibilities and roles, to some of the mandated, I'll say, legislative required training around first aid, whether it's fall protection for our maintenance staff. So we employ a number of different avenues to provide those levels of training. When we look at some of the other larger pieces of our organization, each one of our zones have a professional development department that assists the organization in truly being able to be aware, to be provided some of the online learning, whether it's around hand washing, sanitization, some of the job-specific training that you need within your role, OHS awareness. Then we look at some of those pieces on hands-on, face-to-face, that education perspective that truly a manager can only give to a staff member. Being intimate with regards to the hazards that you're going to see today on your shift as part of your orientation, as a part of your onboarding process. And then we have some of the in-house training providers that we would do some specialized training with, whether it be job-specific roles or best practices within industry or professions. So we truly do touch on training really through all facets of our organization, whether it's from the executive levels and leadership to frontline staff to even our contractors, on educating them on expectations of working within NLH services. So training is such a big piece tied to that education piece.
Right. And what kind of system, I guess, are you using to track the training and ensure that workers are up to date and current on any of their certifications?
So we do certainly have a program internally that through our Learn module that tracks and provides thousands of courses that are individual and offered depending on the type of role that a staff member would employ with us around the needs of that specific role. And within that portal of education, our professional development group are constantly updating, creating, partnering with departments to ensure that those learning modules are current, up to date, and also of best practice. So a part of that as well is the individual pieces within Blue Drop or the Workplace NL pieces of trying to track and monitor some of the more legislatively required training courses. So we truly do use all the tools within our ability to try and make sure that staff are current, staff have the best and the most current offerings available to them.
Absolutely. We talked about communication and the importance of communication as being, one of, I guess, the priority strategies when it comes to identifying and controlling workplace hazards. But it is often a challenge for any organization, no matter how many workers are employed. What types of communication tools are used to get that message out there to all workers? And I guess I'd love to know, how many workers do you employ provincially? Just so we can get a sense of the vast number of people and workers that you are communicating this message to.
So when we look at NL Health Services as a whole and across the province from coast to coast, I've heard a couple of different numbers. Unfortunately, I don't have a number in front of me, but it's in excess of 25,000 employees currently in the province.
That's a small community. That's a city.
Absolutely. I mean, when we look at it, and I've used this as a reference in the past, that NL Health Services staff are one of, I think it's the 3 or 4 largest communities in this province if we were to bulk them into an area. So when we look at no different than any community, communication is certainly a key. Always a little bit of a struggle because we want to make sure the message gets to everyone. And sometimes that's a little bit difficult to do when you look at that such quantity and number of people. So we're constantly trying to improve this process. I know it's something that me personally been trying to work on within our organization and improve. But we try to employ every strategy that we can, once again, to try and get information, especially when it comes to OHS pieces, to all facets of the organization, or to people who are working for us in a contractor perspective, so that they're aware of the hazards that they're going to potentially face coming into our sites to work. So we do heavily rely on email. We do have mechanisms of what we call the intranet, so a portal that staff can log into, and we post information there, our memos and information around hazard recognition or things to be aware of, whether it's OHS or other departments within healthcare. We do like to try and rely on our supervisors as well. So we provide staff huddles, information packages to them, so that when they meet with their staff and their frontline to do their debriefing or their brief for the day, we can get messaging out to them as well. We do use paper copies, not as much as we used to, but there's still posters that we would post up. There are still pieces that OHS boards. We heavily rely on our OHS committees to provide information not only to the committees, but ensure that they take that back to staff. So I think it's certainly something that we're always trying to still improve on, but we try to do really everything that we can. And even within the last couple of years, I'll say in healthcare, we've relied more on some of the live pieces in having all staff calls and using that digital platform of Teams that we use, Microsoft Teams that is, to try and get messaging out from all levels of the organization. So whether it's managers or directors or staff having digital meetings, because it can reach every corner of the organization, to broadcasts, so that our executive team or our CEO may have an hour session to provide information to our organization. So we truly try to use everything that we can to try and communicate. But even then, it's something that I think we all recognize, that when you're trying to communicate with such a large group, it does have its challenges.
What have you done that has been successful in engaging workers to participate in their own health and safety, and to empower them to take ownership of not just their own health and safety and being a safety leader, but as well as protecting the health and safety of everybody that they work with?
I think it does go back to a number of pieces, and you hit on a couple of them, but one that stands out for me is empowerment. So when we actively communicate with our staff and we engage our staff and we empower them to make that positive change and be a part of that process, truly is where we get that engaging piece back. Because it's easy for me to go and do a workplace assessment and walk around some area of one of our facilities and identify things need to change, or there's a cord across a floor, or there's a hazard that we need to work on to try and change. But when we create that level of engagement, that you don't need an OHS person or a committee member or a manager to identify that something needs to change, I think that's truly where the goal is that when we can empower our staff to know that, well, you know what, this is a hazard and this needs to change. And we build a culture around that the reporting pieces are there. And we've tried to break that down in our organizations with regards to our reporting abilities when it comes to a digital platform, our work order systems for maybe our maintenance staffs to repair maybe a infrastructure issue, or there's ice on a sidewalk, and we can report those things. So it's not just verbally, to try and increase that engagement so that staff identify those hazards, report those hazards, and the organization has a mechanism to fix or repair or modify or control those hazards. But when we look at the joint responsibility pieces, I think really it's a partnership with everyone. Mm-hmm. So we look at some of the committees even that we have, not just our OHS committees, but working from all partnerships, having union engagement, community engagement, partnerships with Workplace NL, ourselves, internally, to try and work collaboratively together. And with that joint responsibility, we build a culture within the organizations, not only just in healthcare, but for us in healthcare, it's so important. Yeah. Because when we're all communicating the same language, we're all heading in the same direction, positive things will happen. Mm-hmm. And when we empower our people to be a part of that through communications, committees, and just relationship building, is where we'll see that hazard being controlled.
That's right.
Those issues that we have in the workplace being mitigated, and we can just create a happier, healthier, and safer workplace in healthcare.
Well, I kind of like to say as well that safer workplaces equals safer communities.
Absolutely. Right? I couldn't agree more.
Mm-hmm. Yeah. Well, thank you so much, Gary, for joining me here today in this very important conversation about occupational health and safety in the healthcare industry.
Thanks so much. It's been a pleasure, and it's something that we all strive, not only in healthcare, but I think in this province, to try and improve. And our goal is every day is no one gets hurt, and everyone should be going home as healthy as they came and go back and enjoy it with their families and the things that they love to do. So thanks again for having me, and it's been a pleasure.
Thank you.
Thank you for joining us today. Transcripts are available to use in your workplace to increase workers' knowledge in various occupational health and safety topics. Visit workplacenl.ca for more information on the services we provide to workplaces. Feel free to share the signal on social media to improve workplace health and safety everywhere. Thank you, and have a safe and healthy day.